Today I'm going to discuss something called Herring's Law of Cure. This is a very important law that helps us to understand how your healing process is taking place and how healing is being obtained. So when a patient comes to see me, there's certain things that's quite important. The history, how long a person has had a problem for, what was the reason this disease was triggered, why were they fine before and now they've got this problem. Because you always want to look at what is the reason for the disease to treat effectively. Then you want to look, when you treat a person, why are they getting certain symptoms again? And then my previous video also shows the disease evolution chart, which shows where you're being plotted when you've got a disease. Feel free to check that one out so that this also makes a little bit more sense for you. So Herring's Law of Cure, Dr. Herring looked at what happened when he was treating people and they were getting better, and that was his observation. And it's very interesting because you can observe by these things how a person is getting better and you know that you're on the right track. So one of the first laws that he had is that you want the symptoms that you have at the moment to reappear in reverse orders. Reappear in reverse order. And what he did is he looked at many examples. So I'm going to give you one common example. Patients come and see us. They've got chronic sinusitis. They've had for many years. They might have used conventional medicine at the time when their nose was streaming just to stop it, and then they feel better for a short time, but the symptoms would come back. So what happens is all those things that they were taking just stop the sinusitis. So when the symptoms reappear in reverse order, suddenly what would happen is when we treat them, they get chronic nasal discharge. The body is eliminating. So the symptoms reappear in reverse order. Another very common example that I see is eczema. So what happens is when a person has eczema, obviously this dry, scaly on the skin. Most of the time with conventional medicine, they are given cortisone. You treat with the cortisone, and when you look at the skin, oh, it's so much better. But what happens with most patients when they stop the cortisone, the symptoms come back and the eczema reappears. So they go for another load of cortisone, and the same thing happens. So what happens is, and you see it especially in children when the immune systems are still developing, you treat cortisone, skin is better. A few months later, suddenly there's a little bit of runny nose, rhinitis. Then you start treating their nose with cortisone nasal spray. Oh, nose is better, we think the problem is solved. And then you give it a little bit of longer, and then suddenly what happens is the people and the children, they start to develop chest problems, asthma. So it's basically being pushed deeper into the body. And our goal is not to let the symptoms push into the body, it's to actually get the body to be in balance, and in that way eliminate the problem. So you will see when you treat someone with eczema, oh, suddenly they're getting a runny nose. Then you know, oh, I'm on the right track. And then, sure, suddenly their skin is going to get worse. And then they'll think that the treatment's not working. But it's very important to note, symptoms are reappearing in the reverse order. So take note, and that's why the history is so important. What happened when? So we can plot the progression to know how you're actually going to improve. When the symptoms reappear again, it's not to say that it will be with the same duration that you had it, but there's a process where the body eliminates. The second law of Herring's Law of Cure is from more important organs to less important. And an example with this would be possibly a person who's got a heart problem. Obviously your heart's very important. So the heart gets better, but then suddenly they develop a knee problem. The symptoms are going from more important to less important organ. And even if you just think of the example I just used of the baby with the eczema, you're getting the chest problem, and then from the chest, it goes to the nose, less important, to the skin, even least important. So it's from more important organs to less important. And the third one, symptoms improve from the top down to the bottom. So what this means is, you will typically see if someone's maybe got a rash or eczema, they'll get better first year, and as they get better, it actually is as if it goes out of the feet. So it actually improves from top to bottom. Another very important aspect on this, from top to bottom, if you think of your mind, which is obviously your top, that is the most important part of your healing. So if your mindset, or if you've got an emotional problem happening with you at the moment, that could be linked to your physical problem. So we want the top to improve. So once you know when you're in a better attitude of mind, you're feeling in a better space, those kind of things, healing is also much better to take place. That's why it's very important what we do in our practice. We address the mental and the emotional conditions, because that treats all your disease conditions and your symptoms indirectly as well. So very important. The question is asked, how long does it take for us to get better? How long will it take for me to heal? You look at Herring's law of cure, then you know how you are on the right track. And secondly, you combine that with the the disease evolution chart, because that gives us an idea exactly where our improvement is. And a lot of times people need to commit for a long time, because if there's a problem with the immune system, it takes a while for that immune system to normalize again. So again, each person is treated as an individual, where their problem is, where it came from, where they're in the chart, and how the progression would be. I hope this answers your question on how healing takes place in the body and how long it will take to heal.